Hello, I'm Dr. Suddhasattwa Sen, Senior Consultant, Surgical Gastroenterology, GI Oncology, Laparoscopy and Liver Transplant, presently associated with AMRI Thakuria Hospitals, Ashok Nursing Home in Jodhpur Park and KDQ Center being my chamber. I was a former Senior Consultant with the Fortis Group of Hospitals, Director of Medica and Apollo Group of Hospitals. See, hernia is any sort of an abnormal protrusion of the intra-abdominal content through a natural or unnatural defect in the body, or rather the lining membranes which lines the abdominal cavity. So to make it easy, that the hernias can come out because of increased abdominal pressure or weakness of the muscles at different places. The commonest hernias that we know are the groin hernias or the inguinal hernias. There can be so many different types of hernias in the same region, like the femoral hernia, the obturator hernia and so many other things. Apart from that, the abdominal belly can have hernias at different places, like the umbilical hernia, the paraumbilical hernia, epigastric hernia. There can be ventral hernias, incisional hernias. So commonly we would call the ventral hernias or the groin hernias, and the ones that are post-surgical we would call a incisional hernia. Now, how would we know that there would be a swelling of a certain region of the body, specifically parts of the abdomen, when you cough, when you sneeze, when you bend forward, when you try to do weightlifting? So anything where the abdominal muscles contract, it increases the pressure of the abdomen and those things are pushed out. That is when a hernia has formed. The second thing is, what are the complications that can happen is, gradually with pressure the hernial sac which comes from inside the abdomen will enlarge, and intestine and fat from inside the abdomen would come inside it. Now what are the problems of this? The problems is, it may come in and go out. It is then an aesthetic problem, can give rise to discomfort, pain, etc. But the real problem lies is when the intestine come inside and do not go back. So they get stuck, the blood vessels of them gradually they become congested, and it starts to become necrose, that is gangrene form, which we call the strangulation. So strangulation can have mortality. It is a very serious critical condition. So preferably most of the hernias, when we get with mostly some symptoms, needs to be operated. Now hernia is a problem like fistula which does not have a medical management. You can't do anything with medicines. Since it's a mechanical defect, you would always have to address the problem and get some sort of a surgery done. Now different surgeries have different for different locations, different type of mesh. Coming to the surgeries, it can be done either open surgery, that is conventional, you cut open, or you can do through micro holes, and which is called the laparoscopic procedure. And presently there is something called the abdominal wall repair or AWR. Now coming one by one to the each hernias, for the groin hernias, whether it's open or laparoscopic, the mesh has to be put. A mesh is a synthetic net that we put to reinforce the muscle, but then it is important that the muscle also needs to be repaired at times whenever it is available, to have an extra support to prevent the recurrence of the hernia. Now for mesh repair we would do for the groins, for the ventral hernias, or for the other hernias. Some very small hernias may not require a mesh. However, some cases of hernias, even for the larger ones, a mesh may not be put. Number one, if there is associated infection, if there is associated bowel surgery, if there is any surgery associated which can give rise to increased chances of a mesh, because it's a foreign body in the human body. Now mostly the meshes that are used are Prolene meshes for the outside, but if it is to be put inside the abdomen where it is in contact with the intestines, you will have to put in a composite mesh, because Prolenes may have a effect of adhesions with the bowel that can give rise to various problems. Now what we do is, for ventral hernias we would fix it with tackers. These are like screw like structures you fire from a specialized gun. They would actually put the mesh over the defect. You may close the defect, which is called IPOM plus. You may, very small, you may keep it open. So these are for hernia repairs, open or laparoscopic. Specifically speaking, it's not that laparoscopy is better than open or open is worse than laparoscopy. It is all about the surgeon's choice, surgeon's experience, the condition of the body, the musculature, the surgeon himself. So it's a combined decision and taking the best possible choice in that surgeon's hands. Now coming to The last part of hernia is the abdominal wall repair, where it's a very large hernia consisting of almost the entire abdomen as a hernia. Various sort of component separation techniques, either open or laparoscopic, are done to reinforce and bring the muscles from the side to the center, close the hernia, give a very large mesh. Now, last but not the least, it is very important to know, like fistula, hernias have a tendency to recur. And it's not that it is a surgical fault always, but majority of the time it is a failure of the tissue. That is, the local musculature becomes weak and it gives way to further hernia formation, specifically in patients who are smokers, who has prostate problems, who has constipation. That is, problems where you increase the abdominal pressure deliberately. So these are the places where the chances of hernia recur are more, especially also in the elderly people or people with neuromuscular dysfunction, where the nerves or the muscles are not in synchrony and the muscles are weak. So these things needs to be discussed prior to the surgery.